Hello and welcome back to the Arena of Confidence at IDS. My name is Dr. Artemis Atkins, and for this session, I have the pleasure of welcoming Dr. Rebecca Komischke, who is our key opinion leader for clear aligners. But before we begin, Rebecca comes to us on her birthday today, so I would like to ask everyone on site, and if you feel like at home, to sing a happy birthday to her. Happy birthday to you. Happy birthday to you. Happy birthday, Rebecca. Happy birthday to you. Happy birthday.
Thank you. That was lovely. That was a lovely treat. Thank you. It's beautiful.
Thank you for spending your birthday with us. Seriously,
yes.
That is very cool.
It's been great so far.
I bet it has. Okay, so Rebecca comes to us from Miedebach, Germany, and she is in a group practice. She's a general dentist, like myself, and does quite a lot of practice, her practice in orthodontics and in digital dentistry. So I would like to take a moment, if you don't mind, and introduce yourself to our audience.
Well, I have been in general practice since 2004. I have done every kind of treatment possible. I am a prosthodontist and I do endodontology and parodontology, implantology, and I do love orthodontics. I have done fixed ortho for many years, and in 2008 I became a clear aligner provider, and in 2018, I digitalized my practice and was very grateful to start on ClearCorrect. I became a test dentist for ClearCorrect.
Yes. Tell me a little bit about the overall of your practice. I kind of want our viewers to get a sense for your practice as a whole.
Yeah.
You're in a group practice and you're multi-specialty, right?
That's right.
Share...
Well, we live in a very rural area. We're 3 dentists and we have altogether about 25 employees, and we work together, and altogether, we can provide our patients with every treatment possible. There are only very difficult surgical treatments that we transfer. And so you must imagine that people drive 30 kilometers, 40 kilometers to come and see us.
Right.
And they don't necessarily want to be sent away. And we say, goodbye, we can't offer this treatment to you. You must go here, you must go there. So we're all overall specialists, really.
Yes. Now, quite a lot of your practice is involved with orthodontics.
Correct.
And so give our audience a little bit more of a detailed sense of your background and experience in orthodontics, and also what you do now.
Okay. Well, you see, I really spent many years just doing fixed ortho, right? So we would
brackets, yes.
multi-bracket systems, and we did this for, young adults, for young patients, and, over the years, I found that sticking on brackets on teeth, it was easy enough. It's an easy system, but it does have its faults. And I honestly believe that we have to move forward. And the more I've worked with aligners, the more I see the disadvantages of fixed ortho. So a bracket for me is not the future. I strongly believe in aligners because there is nothing you cannot treat with the aligners.
Right.
Okay, you just need the experience, and you need to know how. But if you do, then you can treat everything. It's amazing.
Very nice. You're also doing your overall treatments with ClearCorrect.
Correct.
So I want to kind of give a sense for our audience about what made you come on board with ClearCorrect, and what's your experience been like?
Well, you see, I started using the Trios 3 shape scanner last year, and I was really successful with my prosthodontics with the scanning. And Straumann and ClearCorrect came together last year, and I was actually asked if I would be prepared to become a test dentist for ClearCorrect. And I said yes straight away because of my belief in clear aligners, and I'd also had, some not altogether good experiences with other companies, so I was looking for someone to work with. And for me, it's fantastic because I'm already digitalized. I can upload everything straight away. The online portal is really easy to use. It's user friendly. The support is fantastic.
Yeah.
And so all this time, this last half year, basically, I've been uploading my cases to ClearCorrect. I've been getting quick treatment setups. They've been very efficient, very professional, and I have been able to see many of my cases through because some of the cases are small cases. Right. And the more difficult cases I'm still working on, but all very successful so far.
Now, you talked a little bit earlier about the degree of complexity that you feel is now you can accomplish with clear aligners versus bracket orthodontics. Share with our audience what level of complexity you feel comfortable going, and what are some indications that you treat now?
Okay. Well, you see, I often see crowding of upper and lower anteriors. Right, that's one of the most frequent things that women come or men come and say, "Oh, my front teeth aren't so nice. Can you make them look nice for me?" So I do a lot of that kind of treatment, just working on the anteriors, making everything nice, harmonizing the arches. But of course, you get patients with diastemas too, so a lot of gap closing, spacing, and also something very frequent are the protruding front teeth,
right,
especially with parodontological patients.
Background, yes.
And these patients you can treat with ClearCorrect too, because you can actually state what force you want to use in the aligner.
Right.
So you can say, look, this patient has slight tooth movement. We'll go down with the pressure we're using. And so even these patients can be treated. And then I go on, I've actually also done extraction therapy with clear aligners. And you can, basically you can do anything you can do with ortho, you can do with clear aligners.
Right. I really like your comment about periodontal disease patients. I used to practice with a very advanced thinking periodontist in my community who, when patients would come in with crowding, his approach in addition to periodontal treatment was actually to send them to us for orthodontic treatment. And we often saw that aligning the teeth better obviously makes it easier for the patient to maintain the hygiene.
Absolutely.
And periodontal disease, in turn, was also improved over time, which was a really great. So congratulations for doing that. That is very well thought out. Now, I know you have a couple of cases to show for us, for our audience. One that's a kind of an easier, more straightforward case, if you don't mind starting with that. And then you have another case that's a little bit more complex, right? Okay. Do you mind sharing your... Thank you so much.
Well, we can see Maria here. Maria is a 65-year-old patient, and she was very unlucky. She had an impacted canine, tooth 3 was impacted, and she had her deciduous canine remained. So she didn't have an inherent lateral incisor.
Right.
And what happened was she lost her deciduous milk tooth, a canine, and the situation was like this. So she'd had some kind of orthodontic treatment, but she'd remained in crossbite. And she lost her deciduous tooth, and she was really unhappy with the way it looked. And she just wanted a bridge, really. And I said to her, well, look, if I can put a crown on that, but, it's not going to look nice. I'm going to have to leave it in crossbite, or otherwise I'd have to devitalize the tooth, build it up with a post. And so I suggested to her, come on, let's do ClearCorrect, And I said, and I'll remove your lower canine in slightly and your upper canine out slightly. We'll open up the space. And this is what we did. And you can see here, I'll show you a treatment setup. Not working. Strong. Oh, sorry.
Technology.
That was me being too quick.
Technology.
Now, you can see the treatment setup. This is what I get when I send my case in to ClearCorrect. I get pictures back. Actually, it's a simulation. And in the top row, you can see the simulation, how it was at the beginning. And at the bottom, you see the end of the treatment setup. So this is exactly what I wanted. I wanted to distalize the canine, wanted to open up the gap for the bridge, and I wanted to remove the crossbite. And so I said, yes, this is what I want. I clicked accept and agreed to the terms and conditions. And I treated the patient. And here you can see what I did was I then used my Trios 3-shape scanner and fitted her with a nice bridge in the upper arch.
Very nice.
So this is what I did, and she's so happy.
How
has no
How long
crossbite.
did this take? Approximately, how long was the duration of this
let me
treatment
think.
for you?
I think in 5 months we were
5
finished.
months.
So it took me 3 months to get the teeth straight, and then by the time we had the
And
bridge
what a
fitted and
difference
everything.
from where she started. Very
it was
good.
amazing. She'd never have done fixed ortho. She'd have just lived with the situation.
Right.
Yeah.
So you offered a solution that she would have otherwise not had.
Yeah.
Very nice. Talk to me about the other one. You have a more complex case.
I do.
You wanted to
This
show.
is the easier case that's coming up now.
Okay.
But it
I was going to say that one seems a little complex to me, but okay.
Now this case, this is one of the crazy cases where the patient comes and she needed 2 bridges. She said, can you do me 2 nice bridges in my upper arch? I need white bridges. So I made her nice bridges. I chose monolithic zirconium dioxide.
Yeah.
And then she said to me, she said, oh, my bridges are lovely, but my front teeth, look at my front teeth, they're not nice. This patient is 70 years old. She's 70. And I really hadn't been expecting for that, because where we come from, people really, they don't necessarily all want beautiful teeth, especially not when they're 70. But she said, I want my front teeth nice. And so I said, well, okay, I can do that. And this is something I could not have done with fixed, because you cannot stick a bracket on monolithic zirconium dioxide. So what I did was I said, no problem. And we had a treatment set up for her. Let me have a look. That was the treatment setup. The upper line is how it was. And the setup at the bottom is how it was supposed to turn out to be. And then I agreed again. And we did that for her. And now if you look at the bottom left or the bottom right, you can see she has a nice arch.
Yep.
And this patient is really happy too. She can smile. Okay, we've got to do the lower arch. But, bit by bit.
We never stop.
We never stop.
Okay, now I have to fix this.
We never stop, no.
How long did this case take you?
That only took me, let me think, I did the bridges and then the ortho 4 months max.
4 months.
It's really quick.
You mentioned your 70-year-old patient. I have a funny story for you. So I'm practicing, and I'm probably 4 years into practice, and I inherit a patient who is 94. She comes to me with her husband, who is 96, and their son happens to be a dentist just about an hour from where I practice.
Okay.
So I thought it was appropriate, and I asked her if it was okay for me to call her son and just kind of align on the care. And she says, yes, but let him know I want veneers. 94. So I call her son and I go, Doctor, your 94-year-old mother is in my practice and she's asking for veneers. How would you like me to, I can. She's perfectly fine. But I recognize at 94, this may be, you may object, so I just wanted to share it with you. And I asked her permission to do this. And he says, she wants veneers, give her veneers. So my 94-year-old patient got 4 veneers and had them till she was 104.
Oh, wow.
And
so it was worth it, 10 years
yes,
is a long time.
She was amazing.
Great.
Anyway, so you never know.
No, you never know. You
okay.
don't.
Now, you mentioned also that you are a digital practice.
Definitely.
That you made the conversion to digital practice.
That's right.
I want to kind of give our audience a sense of what that means, what platforms, what tools do you use for your digital practice?
Well, I digitalized my practice at the beginning of last year, 2018, and it was something I'd been wanting to do for a long time. I'd waited quite a while just to see how the products and the scanners were developing on the market, and I decided to go together with Straumann because I was very convinced of the Trios 3-shape scanner and the other products that Straumann offered. And I must say I never regretted it for one moment. We basically were trained how to use the scanner. Talman came, helped us, and we started scanning from that moment onwards. And we've taken impressions. We have to take impressions when we do splints. But apart from that, it's all done digitally. And so it really all comes together, because I'm now digitally doing my prosthodontics. I'm digitally doing my orthodontics. And, patients are actually coming and saying, we've heard you have this scanner and you don't use impression casts anymore. We want to try it. So, everything's become easier. It's easier for me. It's easier for my assistants. It's easier for the laboratory. Everything's on screen. Yeah, everything's digitally supported. Yes. And we've not regretted that for 1 second.
Very nice.
No.
Talk to me a little bit, if you don't mind, about patient communication.
Okay.
Specifically related, you touched on something that just triggered my curiosity. I used to experience that digitalizing my practice was often a practice builder. In addition to the fact that it helped me with accuracy and with what I needed to accomplish in terms of treatment outcomes, but it was actually a practice builder.
Yeah.
Because of what you said, that there was a perception about that I was more advanced practice than perhaps some of my competitors. Talk to me about what your experience has been since last year, since you've become digital.
Well, I must say, I've had a lot of cases where I've actually done my prosthodontics, crowns, bridges, and lots of abutments on implants, because that really is fantastic. You have your implant, your bone level implant, and you can make your own abutment that really fits right in there, especially in the front and the anterior. And it really, I've not done much advertising at all. I've not had to. Because what's happened is the patients I've scanned have gone out and said to other patients, oh, I went to Rebecca and she scanned my teeth and look at this bridge, isn't it nice? And so, people are coming and just asking for the treatment without me even having to say I offer it.
Right.
It's just word of the mouth, as they say, right?
Yes.
And it's just really taken off, it really has.
Now, what's your patient range? Do you treat, I know you're a general practice and you guys as a group are kind of a multi-specialty practice, so do you treat only adults or do you also treat children?
Yeah, we treat everything. We call ourselves Familienzahnarzt, okay? So we treat the 94-year-old lady with veneers, but we also treat the 4-year-old child who's had trauma to the teeth.
Yes.
Everything in between.
Talk to me about how you feel about clear aligners for your teenagers. Do they keep them? Do they lose them?
Well, I have a few teenager cases. Yeah. You have to choose them very carefully. Yes. So I must say, if you're very careful who you choose, then it really does work.
Yes.
I've made good experiences with teenage girls. If you explain to them how to keep them clean, how to keep their teeth clean, how they work, then they're really right behind it. They're so compliant. Yeah? They have their setup on their mobiles. I send them their setup and they look and check and see, oh, this is great.
Yes.
I've also started to use the Dentigo app.
Okay,
we've already started on that. I'm testing it.
We talked to yesterday. Very good.
So that really will help me in the future if that's, if they keep that up. And so teenagers are not a problem, but you really must choose them carefully.
Right.
I find, there's some children just don't want orthodontics and they say, oh, I don't want that, and then they don't wear them, So if you choose carefully, then it's perfect.
From a health perspective, I often found clear aligners actually kept my patients' periodontal health
much better
than bracket solutions.
Definitely.
So, offering clear aligners even to our teenage, I know they're a little tricky, but it actually helped a lot because I have found far fewer gingivitis cases, far better hygiene cases, because they also can take
it sometimes takes a bit longer. If the patients aren't so compliant, that's also nice, you see. Then you just say to them, I'll just wear them for 3 weeks.
Yes.
So they just need a bit longer.
Yes.
And that's what's so great about aligners, that you don't have to then give up in the middle. You just, keep them wearing them just for a little bit longer. And that is true. It does work like that as well. Yeah.
And I like the Dentigo that you mentioned.
Fantastic. Yeah.
Because for that generation in particular, I can see this being their gadget.
Yeah, they do everything on the mobile.
They're used to this.
And if the mobile says to them, oh, please don't change your aligner for another week, then they don't change their aligner for another week.
We talked about this yesterday when we said, it's an interesting patient engagement.
Definitely.
Because, look, otherwise, between visits, we sort of lose track of our people, right?
Definitely.
Our patients. So they come and then we do whatever and then they leave and then we're done for a period of time. This sort of Dentigo gives them an approach to continue to maintain engagement with us while
Definitely.
helps them stay.
It does, yeah.
Good.
Especially the younger people. Yeah.
So, last question.
Okay.
Are you happy you spent your birthday with me?
Atomus, it was lovely meeting you. It's been really special. And it's been great. I've had a great time here on the stage with you.
I enjoyed hosting you. Thank you for spending your birthday with us.
Thank you.
Another happy birthday to Rebecca Komischke.
Yes.
So on that note, thank you so much for your time. And on behalf of Straumann from the Arena of Confidence, my name is Dr. Artemis Atkins, and I will return in a few minutes with Dr. Nikolai Makarov when we will talk about Synergy, Co-Diagnostics, and CARES Visual. From Cologne, Germany, auf Wiedersehen!
Wiedersehen.